Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Menstruation. Introduction. Menstruation is monthly discharge of blood and other tissues by a woman's body. It is also known as the period. Each month, the woman's body prepares for pregnancy. If pregnancy does not happen, the uterus sheds its inner lining. The menstrual blood is the blood and tissue from inside the uterus, or womb. Periods usually start around age 12 and continue until menopause, which happens to most women between the ages of 40 and 55. Most periods last from 3 to 5 days. This program explains menstruation. It reviews the female reproductive system and describes a regular menstrual cycle. A special section for teenagers addresses common questions about the first and subsequent periods. Female reproductive system. The following section reviews the female anatomy as it relates to menstruation. The female reproductive organs include the ovaries, the fallopian tubes, the uterus or the womb, the cervix, the vagina. The female reproductive organs are located in the pelvis, between the urinary bladder and the rectum. The ovaries are glands with two main functions. 1. The production of hormones, such as estrogen and progesterone. 2. Ovulation, which is the release of eggs needed for reproduction. Estrogen and progesterone prepare the inner lining of the uterus, also known as the womb, in case a pregnancy takes place. These hormones also regulate when eggs are released. When an egg is released, it goes down the fallopian tube and into the uterus, where it may or may not be fertilized by a sperm. If fertilized, the egg becomes implanted in the uterus, where the fetus grows. If not fertilized, the egg and the inner lining of the uterus are discharged to the outside of the body through the cervix and the vagina during the menstrual period. The menstrual cycle usually lasts 28 days. The levels of estrogen and progesterone increase before and after ovulation. If the egg is not fertilized, hormone levels decrease and menstruation begins. Estrogen and progesterone are only two of the main hormones that control the menstrual cycle. Menstrual cycle. When periods or menstruations come regularly, this is known as the menstrual cycle. Having regular menstrual cycles is a sign that a woman's glands and reproductive system are working normally. During the menstrual cycle, glands in a woman's body provide important body chemicals, called hormones, to keep her healthy. It also prepares her body for pregnancy each month. The rise and fall of the levels of these hormones control the menstrual cycle. A cycle is counted from the first day of one period up to and including the day before the next period begins. On average, a cycle is 28 days, but cycles can range anywhere from 21 to 35 days in adults and from 21 to 45 days in young teens. The length of time that a period lasts can vary. Some women only have their period for 2 to 3 days. Other women may have their period for as long as 7 to 10 days. The amount of blood that comes out of the vagina can also vary. Many women have about 2 tablespoons of blood, while others have more or less. Some women also experience pre-menstrual syndrome, or PMS, cramping, irregular periods, heavy menstrual bleeding. These symptoms will be discussed in the following sections. For teenagers, the average age for a girl to get her first period is 12. This does not mean that all girls start at the same age. A girl can start her period any time between the ages of 8 and 15. Girls may notice an increased amount of clear discharge from the vagina 6 months or so before getting their first period. This is common. Unless the discharge causes itchiness or has a strong odor, there is no need to worry about it. The first period often starts about 2 years after a girl's breasts first start to develop. If a girl hasn't had her first period by age 16, or if more than 2 to 3 years have passed since her breasts started growing, she should see a healthcare provider. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Pads and tampons. Sanitary pads and tampons absorb menstrual blood. Some women decide which one is best for them and use it exclusively. Other women use a combination. Pads stick to the inside of the underwear and are absorbent. Some pads are thinner for days when the period is light, and some are thicker for when there is more bleeding. Thicker pads can be used at night during sleep. Tampons are put inside the vagina to absorb the menstrual blood before it leaves the body. If a girl is concerned about breaking her hymen, she should talk to her healthcare provider before using a tampon. All tampons have a string at the end to help take it out when it needs to be changed. Tampons should be changed every 4 to 8 hours. Some girls and women use menstrual cups instead of sanitary pads and tampons. A menstrual cup is inserted into the vagina to catch and hold the blood instead of absorbing it. This can prevent toxic shock syndrome, which is discussed later in this section. If leakage is a concern, a type of liner can be placed in the underwear. This liner is called a panty liner. On light flow days, some women use the liners alone and avoid using a tampon or a pad. No one can see that a woman is using menstrual products, although some pads may feel a little bulky. Many women try different products to find the one that is right for them. Whichever product is used, it is important to follow the instructions on the packaging. Hands should always be washed before and after use. Using tampons that are too absorbent or not changing them often enough puts a woman at risk for toxic shock syndrome, also known as TSS. TSS is a dangerous bacterial infection that may cause death if left untreated. TSS can be avoided by not using tampons at all, changing tampons often, switching back and forth between tampons and pads. The symptoms of TSS can be caused by many other illnesses. It is important to talk to a healthcare provider if any of the symptoms of toxic shock syndrome appear. Contact a healthcare provider if any of the following symptoms of TSS develop while using tampons: sudden high fever, muscle pains, dizziness or fainting, a body rash that looks like sunburn, redness of eyes, mouth, and throat, abnormal vaginal discharge, a feeling of confusion. Healthcare providers treat TSS with antibiotics. They examine the kidneys and liver to make sure they are working okay. A healthcare provider can also treat a rash to help it heal. It is important for women and girls to get medical help right away if they have the symptoms of TSS. A period doesn't have to get in the way of exercising or being active. Girls and women who have active lifestyles and enjoy activities like swimming, jogging, or playing sports may benefit from using tampons. Girls who have questions about pads, tampons, or coping with their periods should talk to an adult. A parent, older sister, health teacher, or school nurse can all be excellent resources. Cramps. Some women may notice physical changes near the time of their periods. More than half of all women who menstruate say that they experience cramps for the first few days of their periods. Cramps that happen as the result of a period are known as menstrual cramps or dysmenorrhea. Cramps are caused by a chemical called prostaglandin. Prostaglandin makes the muscles of the uterus contract. Menstrual cramps affect people differently. Some girls and women experience dull and achy cramps in their back or abdomen. Others have sharp and intense cramps in these areas. Cramps may become less uncomfortable over time. They may even disappear. Over-the-counter pain medications like ibuprofen and acetaminophen can relieve the pain from cramps. Taking a warm bath or placing a heating pad on the lower abdomen can also relieve some discomfort. Some women find that regular exercise lessens cramps. If treatments don't work, talk to a healthcare provider about other treatments. PMS. Some girls and women experience emotional changes during the few days or week before their period. This may be the result of premenstrual syndrome or PMS. PMS can cause feelings of sadness or irritation. It may cause someone to get angry more quickly or cry more often than usual. Sometimes PMS causes cravings for certain foods. PMS can also cause physical changes in the body. The body may retain more water than usual and cause a bloated, puffy feeling. Swollen or sore breasts and headaches may also happen. Some girls and women have an acne flare-up during this time. The physical and emotional changes that happen during PMS are caused by rising and falling hormone levels. PMS often goes away after the period begins, but it may return each month. Eating healthy foods, getting plenty of sleep, and exercising may relieve the symptoms of PMS. Women who are concerned about their premenstrual symptoms should talk with their healthcare provider. Irregular or missing periods. Having regular periods means that the reproductive system is generally working normally. Sometimes a girl or woman will have an irregular menstrual cycle. This means that the period comes at a different time each cycle, or a period was missed entirely. It is common for girls who are just beginning to menstruate to have irregular periods. For example, a girl may miss a month after having regular 28-day cycles for 2 months. Periods often become more regular after a year or two, but some women have irregular periods into adulthood. Women who have a regular menstrual cycle may start having irregular ones if they are sick, stressed, or if they are exercising or dieting. Women with anorexia nervosa usually stop having periods. In some cases, not having menstrual periods can mean that the ovaries have stopped producing normal amounts of estrogen. Missing these hormones can have important effects on overall health. Hormonal problems, such as those caused by polycystic ovary syndrome, or serious problems with the reproductive organs, may be involved. Talk with a healthcare provider if your periods are not regular. In both teens and women nearing menopause, hormonal changes can cause long periods along with irregular cycles. Even if the cause is hormonal changes, treatment may be available. Hormonal changes can happen with other serious health problems, such as uterine fibroids, polyps, or even cancer. See a healthcare provider if any abnormal bleeding occurs. Contact a healthcare provider if your period suddenly stops for more than 90 days. Periods become irregular after having regular monthly cycles. Period happens more than every 21 days or less than every 35 days. Bleeding happens for more than 7 days. Bleeding happens in between periods. Bleeding is heavy. Extra-menstrual bleeding. Another problem associated with menstruation is abnormal uterine bleeding. This is vaginal bleeding that's different from normal menstrual period. It includes bleeding between periods, bleeding after sex, spotting any time in the menstrual cycle, bleeding heavier or for more days than normal, bleeding after menopause. Abnormal bleeding may have many causes. A healthcare provider may start by checking for common problems in the patient's age group. Some of them are not serious and are easy to treat. Others can be more serious. Treatment for abnormal bleeding depends on the cause. Contact a healthcare provider if bleeding is heavier than usual or more than 1 pad or tampon is used every 1 to 2 hours. Bleeding happens between periods.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Menstruation is a monthly discharge of blood and other tissues by a woman's body. It is also known as the period. Each month, the woman's body prepares for pregnancy. If pregnancy does not happen, the uterus sheds its inner lining. The menstrual blood is the blood and tissue from inside the uterus. Periods usually start around age 12 and continue until menopause, which happens to most women between the ages of 40 and 55. Most periods last from 3 to 5 days. A cycle is counted from the first day of one period up to and including the day before the next period begins. On average, a cycle is 28 days, but cycles can range anywhere from 21 to 35 days in adults and from 21 to 45 days in young teens. Some women also experience premenstrual syndrome or PMS, cramping, irregular periods, heavy menstrual bleeding. Sanitary pads and tampons absorb menstrual blood. Some women decide which one is best for them and use it exclusively. Other women use a combination. Cramps that happen as the result of a period are known as menstrual cramps or dysmenorrhea. Some girls and women experience dull and achy cramps in their back or abdomen. Others have sharp and intense cramps in these areas. Some girls and women experience emotional changes during the few days or week before their period. This may be the result of premenstrual syndrome or PMS. PMS can also cause physical changes in the body. The body may retain more water than usual and cause a bloated, puffy feeling. Swollen or sore breasts and headaches may also happen. Some girls and women have an acne flare-up during this time. Sometimes a girl or woman will have an irregular menstrual cycle. This means that the period comes at a different time each cycle, or a period was missed entirely. Another problem associated with menstruation is abnormal uterine bleeding. This is vaginal bleeding that's different from normal menstrual periods. Thank you for using Explain.